the protocols are different. And again, we'll talk to Sanjay in a little bit, but I want to go to Deborah first. Deborah, nurses are really on the front lines here. And, there is a concern now that Nina Pham contracted Ebola from Thomas Eric Duncan. Nurses are saying now we need more training, we need better equipment, and they don't feel safe.
You're right, we do not feel safe. We've been doing surveys of our hospitals. We have over 745 hospital nurses, hospital sites responding, saying that clearly 80% of the nurses still to this day have not been given any information about Ebola. If they have not had any ability to practice, drill, train with the hands-on equipment that they're going to be using and the protective gear, and that they don't have the supplies they need even for just a flu epidemic in our communities. And so we are concerned.
85% say that their hospital has not provided education on Ebola. 40% say their hospital has insufficient current supplies of eye protection for daily use of their unit. And then 38% say there are insufficient supplies of fluid-resistant impermeable gowns in their hospital. That's serious stuff when you're on the front lines. Doctor, what do you make of how nurses are feeling now? Dr. Sanjay Gupta.
I mean, that's very, obviously very concerning. I mean, you don't want to hear that. And, it's striking down as much as we talk about vaccine trials and experimental medications. What we're talking about there is bread and butter stuff. I mean, that's the low-hanging fruit. If we can't get that right, it makes it more concerned that we're going to get the other stuff right. I will say that, this idea that, you could simply, if someone doesn't feel comfortable and you're asking them to go take care of a patient with Ebola, they haven't been trained, just the adrenaline, the anxiety from all that, I think the chance of making an error does go up. So you want them to feel as comfortable as possible.
Dr. Gupta, I want to get to the conversation that we had last week about mutation, because there's some concern